New research suggests pregnancy complications may increase your risk of heart disease later in life. Plus, how social media is influencing e-cigarette use among teens and childhood vaccination rates are dropping. Those stories and more in tonight's Health Watch. Vaccination rates for children have stalled around the world. New analysis published in The Lancet shows more than 15 million children worldwide haven't received any life-saving vaccines. There are currently several outbreaks of vaccine-preventable diseases, including polio overseas and measles here in the U.S. The report says addressing vaccine availability and misinformation about vaccines is critical. Social media may be influencing more teens to use cannabis or e-cigarettes. New surveys conducted by Keck School of Medicine of USC found teens who saw influencers or celebrities using e-cigarettes or cannabis on popular social media sites were more likely to start using them themselves. Deaths among newborns are on the decline in the U.S. A study published by the Journal of the American Medical Association looked at data over the last few decades and found that the declines are likely due to medical advancements and better care. However, the data also showed infant deaths due to malnutrition have risen 2%. Women who have complications during pregnancy are at a higher risk for stroke, even decades later. A study by UT Health Houston showed that pregnancy functions as a sort of stress test for the body, and common pregnancy complications could be an early warning sign for cardiovascular disease. Up to 1/3 of all pregnancies are affected by complications. And we're learning more about how too much screen time can harm the mental health of young people. New research found excessive screen time can lead to lack of sleep, which impacts the connections of the brain. Teens who were spending a lot of time on their tablets and phones were found to have weaker connections in the parts of the brain that regulate emotion and control memory and attention. Researchers say girls are generally more susceptible to emotional concerns with greater screen use, while boys are more likely to turn to screen time when facing emotional challenges. For a closer look, head to the feature section of 2news.com and click on the Health Watch icon.